10 questions in each round. For every question, the participant shall be given 10 seconds to answer. All questions are multiple choice. All answers will be in before 10 seconds in the chat box. Answers that are in beyond given time will be invalid. Questions or clarifications will be raised only after the declarations of answers to the question. Next, please. No questions, clarifications shall be entertained the moment the quizmasters begin to read the next question. In case of tie or tiebreaker, the tiebreaker questions will be asked, and the first person who will be uh, get the correct answer shall be the winner of the tie-breaking round. Judges will decide for the winner of the tie-breaking round. Sorry for that. Next, the decisions of the board of judge and committee shall be considered final and irrevocable. Next, Pats. The first, second, and third with the highest accumulated scores shall be declared champion, first runner-up, and second runner-up, respectively. Okay, for the first round, we have questions clinical one for clinical chemistry, clinical microscopy, parasitology, microbiology, immunoserology, blood banking, histology, hematology, medtech laws, and clinical chemistry. Next, please. Okay, we'll first now for our first round. I will read the question twice, then after that, I will be given 10 seconds for you to answer the question. First question, for clinical chemistry, round one. Clinical assay for tumor markers are most important for A, screening for the presence of cancer, B, monitoring the course of a known cancer, C, confirming the absence of disease, and D, identifying patients at risk for cancer. Next, please. Fats. Fats, please press Fats the timer, Fats. Yeah, yan, Fats. Okay, your answer should be in the chat box already. And the answer is Fats. Next, Fats. Answer will be letter B. Tumor markers are useful for monitoring therapy, detecting recurrence, and aiding in prognosis of tumors, but are not useful for screening the general populations for cancer. Next, number 2. In automated urine screening system, the technology applied in urine flow cytometry is A, diode laser, B, digital imaging, C, microwave, D, reflectance. In automated urine screening system, the technology applied in urine flow cytometry is A, diode laser, B, digital imaging, C, microwave, D, reflectance. Next, Fats. Okay, answers are in the chat box. The answer is A, diode laser. Next question. This filarial worm causes severe allergic pigmented rash, skin disease, blindness, a result of microfilarial migration through eyes. This filaria is known as A. Loa loa, B. Onchocerca volvulus, C. Manzonella ozardi, D. Depetalanema pertstan. The filarial form causes severe allergic pigmented rash, skin disease, blindness as a result of microfilarial migration through eyes. This filaria is known as A. Loa loa, B. Onchocerca volvulus, C. Manzonella ozardi, and D. Dipetelanema perstans. Okay, answers are in the chat box. And the answer is B. Onchocerca volvulus. Next, please. Question number 4, microbiology. Pontiac fever is an acute, non-fatal respiratory disease caused by various species of base gram-negative bacteria. A. Mycoplasma, B. Haemophilus, C. Legionella, and D. Bordetella. Pontiac fever is an acute, non-fatal respiratory disease caused by various species of these gram-negative bacteria. A. Mycoplasma, B. Haemophilus, C. Legionella, and D. Bordetella. Next.
Hi, Sir Richard.
Yes, ma'am.
Sir, I think we're too fast, so we
Okay,
can't
okay, okay.
actually get the one who we can actually record. We can't record the one who got the correct answers.
Okay, ma'am. Sorry for that, ma'am.
Yeah, yes, sir. Can we go back to the first question, sir? Parang i-browse lang natin yung tamang sagot and then we'll try to see if who got the correct answers.
I will just give you, ma'am, the ano, ma'am.
Yeah, because it's hard, sir, to.
Okay. Wait lang,
Yes,
ma'am.
sir.
Saglit lang, ma'am. Tingnan ko muna, ma'am.
So for a while, for a while.
Okay. For the participants, kindly put numbers before you answer para ano namin, ma-monitor. Pwede ba? Palagay na lang ng number.
Yes. Sir Richard, can we start
Yes
with the
po.
first participant who answered the first question so that matatali po namin?
Sige, ma'am. For ZZMC Clinton, ilan ba ang participants natin, ma'am? Hello, ma'am. Ma'am Arlene?
Hello, sir.
Oo, okay na?
Wait, sir, sandali lang.
Okay, okay,
Actually,
no worries.
sandali lang, sir, ha, sandali lang.
No worries
Actually,
po.
hindi ko mahabol. Wait, ito yung,
Okay, ma'am.
dito po tayo mag-start kay,
Sige,
sandali
ma'am,
lang,
i-ano mo
ha.
muna, ma'am.
Check ko muna. Ito
I-check
yung
mo
si
muna.
Sir Clinton. Sir Clinton, kayo po yung,
First, ma'am. Yes, ma'am Lynn. First.
okay, so i-ano natin, ha. So, Sir Clinton, ZZMC, si Sir Clinton. So, ito po yung first. Tapos, sino po yung ating second? Si Emma Aguilar, tama po ba ako? Hello.
Aguilar, ma'am. Emma Aguilar.
Okay. So,
Then,
tama po. Si Emma is check po sa first question, right? Tama siya, may 1 point
yes.
siya. And then, the third is
Brent,
si Aryan.
Aryan.
Agoo.
Yes, ma'am.
Okay, so check din siya sa first question.
Vuzi.
And then, next is si Bernice. Brianna. Okay, so check din siya. Next is
Denise, ma'am.
Denise. Mignon. Tapos check din siya sa first question. And then
Aishar ba ito?
okay,
Husin?
so yeah, si Aishar Husin. So wrong siya sa first question. And then si Camille.
Yes, ma'am.
Camille Lambo. Check sa first question. And then
John Wilhelm.
si Ong Chua. So check siya sa first question. And then si Alfrancis Lexor.
Yes, ma'am.
So wrong siya sa first question. And then si
Bustamante.
Yeah, Grace Bustamante. So check siya sa first question. And then si Grace Bustamante is number 10. So ulitin natin na. First si Clinton, second si Aguilar, number 2 si Aguilar, third si Agoo, fourth si Brianna, fifth si Dennis, sixth si Aishar, 7 si Camille, 8 si John Ongchua, 9 si Alfrancis, 10 si Grace Bustamante. Tapos yung number 11 is si Armalin Jimbol. Okay, so check siya sa first question. And then, okay, babalik tayo kay Sir Clinton. Sir, yung question number 2, Sir Richard, ano yung tamang sagot? Question number 2 po.
A po, ma'am.
Okay, check si Sir Clinton, si Alfrancis. Wait muna. Siguro maglalagay sila ng number 11, ng number nila. Like si Alfrancis number 9. So wrong siya. Ang check natin, tingnan natin sino ang check letter A. Sino ang A dito?
Hello, Ma'am Lynn.
Yes, ma'am.
Ma'am, si Miss Armalin Jimbol is not a participant daw.
No.
Saan siya?
Yes.
Hindi siya participant?
Yes.
Okay, erase ko siya?
Okay, ma'am. Yes, ma'am. Please. Thank you, ma'am.
Okay, sige. So, si Agoo, yung sa second question is check. Tama ba ako? Right? So, second question. And then, si Aishar. Ano yung F? Ano to? Hindi na natin alam anong question na ito.
Kasi number 2 pa lang yata tayo, ma'am.
Oh, yes, pero yung si John Wilhelm, dalawa na ang ano mo. John Wilhelm, dalawa man yung sagot mo, Noy. Ano to? F?
Sa F. Wala yan F, ma'am. Wala naman sa choice na mali.
Wala. Okay. So ito yung D.
Apo.
Okay, so pero ang correct answer is letter A naman, di ba?
Yes,
Yes
ma'am.
po.
So how do we know that this is the third question ngayon, sir?
Wala
Ito
pa
na po
tayong
ba?
third question.
Second pa
Third
lang,
question.
sir.
Second pa ba, Pat?
Yung para naman, sir.
Fourth na pala.
Kaya
Fourth
nga,
po.
actually mahirap, sir. Mahirap siya ano kasi wala siyang
Okay, balik na lang tayo sa third questions, ma'am.
sige, sir,
Balik na
kasi
lang tayo.
nahirapan tayo. Sa
Yes,
third
ma'am.
question,
Balik,
tapos
ganito na lang gagawin sa participants. Prior sila mag-answer, kindly put first the number of the number of the question, for example, number 3, and then your answer. Okay?
Q3 lang, sir. Q3. Q4. Question 3, question 4.
Q3, tapos, or number 3, and then answer. Pwede na yun siya.
Tapos state din nila kung anong number sila kasi meron silang 1, 2, 3 hanggang 10. Para mabilis sa checking. Kasi by number yan sila. Anyway, may pangalan naman. Sige na, okay na po.
Yes, ma'am.
Okay na, sige
Numbers
na,
na
okay
lang
na.
tayo, ma'am.
Opo,
Okay.
sige. Q3 na lang
Okay.
ganyan. Sige, okay. Start na po.
Okay,
Number 3
balik
po tayo.
ha. Balik
Sa number
tayo
3
sa
po.
number 3. Oh, sorry kasi first time natin. Ganito talaga ang live. Okay? Number 3, balik tayo ha. This filial worm causes severe allergic pigmented rash, skin disease, blindness as result of microfilarial migration through eyes. This filaria is known as A. Loa loa, B. Onchocerca volvulus, C. Manzonella ozardi, D. Depetelanema perstans. This filial form causes severe allergic pigmented rash, skin disease, blindness as a result of microfilarial migration through eyes. This filaria is known as A. Loa loa, B. Onchocerca volvulus, C. Manzonella ozardi, and D. Depetelanema perstans. And the correct answer is letter B. Onchocerca volvulus.
Okay, so Francis, wait lang.
Uh,
Um,
attention to the participants. Kindly mute your audio, please.
Fatima. Kasi kung pwede lang sana ilagay yung number talaga ng pangalan nila kasi nahirapan ako sila. Si Fatima, wait ha. Rashima, sana yung si Fatima. I still have to, bakit walang Fatima, Rahima, ito. Si Miss Fatima. Rahima. And then, Brianna is correct. And then, Wilhelm is also correct. Denise is also correct. Aryan Agoo is correct. And then Clinton is also correct. Aishar is check. Bustamante is check. Lambo is check. Oh, this is Lambo Camille. Check din si Miss Camille. Mohamed Jan, Luis, Mohamed Jan. Is check, and then Sir Clinton? Sir, dalawa na kayo naglagay, sir. Si Grace Bustamante. Just check. Okay. So siguro yung magbigay ng sagot, pwede isang beses lang para hindi magdoble. Thank you.
Thank you. Okay, next question. Number 4 for our first round, microbiology. Pontiac fever is an acute, non-fatal respiratory disease caused by various species of the gram-negative bacteria. A. Mycoplasma, B. Haemophilus, C. Legionella, and D. Bordetella. Pontiac fever is an acute, non-fatal respiratory disease caused by various species of this gram-negative bacteria. A. Mycoplasma, B. Haemophilus, C. Legionella, or D. Bordetella. Time's up. Answers must be in the chat box. And the answer is letter C, Legionella.
Okay, so Mohammed is correct. And then Fatima Rahima is checked also. Dennis is also checked. Alfrancis is also checked. Bustamante, Bernice Brianna Banagudos. Okay, Banagudos is checked. Banagudos. Clinton, check. Sar, Hussein, check. Ong Chua, Wilhelm is check. Bustamante is check. Agoo is check. Fatima Mayeza. Fatima Mayeza. Fatima Mayeza. Ito ba si Fatima Mayeza? Ito na ba si Fatima Rahima? Parehas lang ba ito?
Iba po, ma'am.
Iba din.
Lahat po sila, ma'am, correct.
Okay, Fatima Mayeza. Ano na ano ko? Hanggang kay Fatima Mayeza lang ako nakaano. Yung sina Camila Lambo, hindi ko makita yung score nila. Walang Lambo lumalabas. Sa akin dito. Hello, Sir Philip.
O wala po ata sila nag-type, ma'am, or
Wala sila nag-type.
nag-direct message po ata sila sa host.
Okay, sige. Thank you. Okay, Sir Richard, okay na po. Next question na po.
Okay, next question. For immunoserology. It is used to detect antibodies in a sample allowing soluble antigens affixed or absorbed to the particle. A. Direct active agglutination. B. Indirect passive agglutination. C. Reverse agglutination. Or D. Latex particle agglutinations inhibition. It is used to detect antibodies in a sample allowing soluble antigens affixed or absorbed to the particle. A. Direct active agglutination. B. Indirect passive agglutination. C. Reverse agglutinations. or D, latex particle agglutination inhibition? And the correct answer is letter B, indirect passive agglutination.
B as in boy, sir.
Yes po, ma'am.
B as in boy.
Nobody got the correct answer.
Yeah, nobody got the correct answer, yes.
Okay. Let's proceed to number 6. HDFN, fats balik. That's number 6. HDFN is most common in the following situation. A, mother is positive, father is negative, baby is positive. B, mother is positive, father is positive, baby is positive. C, mother is negative, father is negative, baby is negative. Or D, mother is negative, father is positive, baby is positive. For HDFN, weight fats, FDFN is most common in the following situation. Mother is positive, father is negative, baby is positive. B, mother is positive, father is positive, baby is positive. C, mother is negative, father is negative, baby is negative. Or D, mother is negative, father is positive, baby is positive. Timer start now. Okay, answers must be in the chat box. And the answer is letter D.
As in dog, okay.
Yes, ma'am.
So, Al Francis is check. Clinton is check. Fatima Rahima is check also. Manchua is wrong. Fatima Mayeza is check. Agoo is check. Brianna is wrong. Bustamante is check. Mignon is check. Aishar is check. Hanggang kay Aishar lang ako. Wala na.
Okay, let's proceed to the next question. Fats. For histopathology, number 7 question. The use of nigrosin-eosin stain is to test for the viability of the spermatozoa. The dead sperms are colored A, red, B, black, C, colorless, D, white. The use of nigrosin-eosin stain is to test for the viability of the spermatozoa. The dead sperm are colored A, red, B, black, C, colorless, or D, white. And the answer is letter A, red. Ma'am Arlene?
Okay, so Fatima Mayeza is check. Brianna is check. Banagudos is check. And then Bigdon is check. And then Grace Bustamante is check. Mohammed John is check also. Agoo is check. Clinton check. Wilhelm wrong. Aishar check. Fatima Rahima check. Francis Lexor is check. Okay, hanggang dun lang po.
Okay, next question, please. Hematology, number 8. There are RBCs with slits like central pallor. They may be found in liver disease, alcoholism, and electrolytes imbalance. Shaped like a bowel, they are considered as artifacts. They are called A, elliptocytes, B, dacrocytes, C, spirocytes, and D, stomatocytes. There are RBCs with slit-like central pallor. They are maybe found in liver disease, alcoholism, and electrolytes imbalance. Shaped like a bowl, they are considered as artifacts. They are called A, elliptocytes, B, dacrocytes, C, spirocytes, and D, stomatocytes. Timer starts now. Okay, the answer is letter D, stomatocytes.
Kayo pa ganon. Bukuan siya.
Okay, so letter D po, no? Letter D po.
Yes, ma'am. Letter
Letter
D.
D. Letter D. Letter D. So Dennis check. Bernice check. Aishar check. Fatima Mayeza check. Bustamante check. Alfrancis check. Clinton check. Fatima Rahima check. Agoo check. Wilhelm check. Wrong. Wilhelm wrong. Yun, hanggang doon lang.
Okay, let's proceed to the next two questions. Number 9, under MedTech law. Under Section 24 of RA 5527, the penalty of reprimand or suspensions of certificate of registration of an erring medical technologist requires how many votes from the Board of Medical Technology? A, 1, B, 2, C, 3, D, 4. Under Section 24 of RA 5527, the penalty of reprimand or suspension of certificate of registrations of an erring medical technologist requires how many votes from the Board of Medical Technologists? A, 1, B, 2, C, 3, or D, 4? And the answer is letter B, 2.
Okay, so Mignon, check. Wilhelm, check. Bustamante, check. Hussein, check.
I think they are all correct.
Bernice, check ko lang kung lahat nag-answer, sir, no? Bernice, check. Agoo, tignan ko lang kung lahat nakapindot. Agoo, Clinton, check ko lang. Fatima Mayeza, Al Francis, Fatima Rahima. Hanggang doon lang, okay?
Thank you, ma'am. And our last question will be from clinical chemistry. High uric acid levels in the urine are seen with A, gout, B, multiple myeloma, C, metastatic cancer, or D, all of the above. High uric acid level in the urine are seen with A, gout, B, multiple myeloma, C, metastatic cancer, or D, all of the above. Timer starts now.
Hello, Cha.
Yes, yes.
Na-disconnect daw si Sir Clinton.
Okay, i-wait lang nato siya.
Okay, sige, sige. Thank you.
Are all participants in their answers in the chat box? Are all participants already in their answers in the chat box?
Ma'am Fats, na-disconnect po ako, Ma'am Fats.
Disconnect. Clean? Clean? Hindi mo narinig yung number 10?
Yes, narinig yung number 10, na-disconnect po ako.
Pats?
Yes, Chang.
Kindly ano na lang Pats sa number 10 Pats.
Okay, wait, Chang.
Hindi pa man nabigay ang answer, di ba? Back mo na lang. Number 10 Pats. Okay. High uric acid levels in the urine are seen with A, gout, B, multiple myeloma, C, metastatic cancer, or D, all of the above. High uric acid levels in the urine are seen with A, gout, B, multiple myeloma, and C, metastatic cancer, or D, all of the above. Timer starts now, Clint. Okay, and the answer is letter D, all of the above. It can be
Please.
seen. It can be seen in gout, multiple myeloma, metastatic cancer, for the uric acid. Can be seen in the yes, ma'am.
Okay, so Francis, D, check. Bernice, wrong. Agoo, check. Aishar, check. Bustamante, wrong. Sino to? Birin, wrong. Wilhelm, wrong. Dennis, wrong. Clinton, check.
Okay. Meron po tayo nag-ano dito for disconnection daw, halos lahat ng questions. Sorry, hindi ka kasi nagsabi sa amin earlier. No? Kanina sana 'yon para ma-repeat natin. Kaso lang tapos na tayo sa round 1.
Aldin,
Yes,
sagutin mo
you
daw
may.
ito.
Yeah, ma'am.
Okay na, sir. Okay na.
Okay na, okay. Okay, for Al Francis, no, Lexor, you may change your device before we will start for the round 2. Ma'am Lynn, can you wrap up the score of the participants po?
Okay, so for Clinton, 8, total of 8 checks, 8 correct answers. Aguilar, 1. For Agoo, 9. For Bernice, 6. For Denise, 7. For Hussein, 7. For Camille Lambo, 2. For Wilhelm, 4. For Alfrances, 7. For Bustamante, 8. Fatima Rahima, 6. Mohammed Jan, 3. Fatima Mayeza, 5. So our highest is Aryan Agoo.
Next will be
Followed by Bustamante. And then we have 3, Bustamante and Clinton.
Okay,
We got
congratulations
8.
for the top
Okay.
3.
Top 3.
Okay, we will now proceed for our round 2 of our quiz show.
Excuse, Chang.
Yes,
Nine
po.
chat. Eva Aguilar and Fatima Rahima Aguilar is
Yeah.
one person lang daw.
Ano yun?
Si Aguilar, ma'am, one person lang daw na siya. Si Ima and Fatima.
Okay, so mag-add ako ng 1 kasi dito sa first, Ima Aguilar kasi ginamit niya. Tapos next is Fatima Rahima.
Yes, ma'am.
So Aguilar pala ito siya. Okay, mag-add ako 1 sa kanya.
Oh, be sure ha, isa-isa lang tayo account.
Isang pangalan lang kay may.
Mahilo ang
So 7 si Ima, Fatima. 7 yung kanyang score. Okay.
Okay, yung isa, Yung si Miss, ano ba to? Miss or, si Brin? Mr. Brin, okay ka na?
Anong brain? Sino si brain?
Merong Brin.
Nadi-disconnect pa rin po. Birin, sir.
Birin. Okay.
Birin, ano po yan?
Okay ka na?
Ano yun? Muhammad
Sige lang, sir.
Jan.
Bala na po kahit ma-disconnect.
Okay, sige. Okay, we will now start for our round 2 for related laws. What is the complete name of RA 10586, which removes the mandatory drug testing as a requirement for applications of driver's license, which was approved last May 27, 2013? A. Anti-Drug and Drug Driving Act of 2010. B. Anti-Drunk and Drug Driving Act of 2012. Or C. Anti-Drunk and Drug Driving Act of 2013. What is the complete name of RA 10586, which removes the mandatory drug testing as a requirement for applications of driver's license, which was approved last May 27, 2013? A. Anti-Drunk and Drug Driving Act of 2010. B. Anti-Drunk and Drug Driving Act of 2012. Or C. Anti-Drunk and Drug Driving Act of 2013. Timer start now.
Okay na, Chang?
Okay, the answer is letter C, Anti-Drunk and Drug Driving Act of 2013.
Okay, so question number, wait lang ha. Number 1, sandali
One.
lang, sir. Okay, wait, sandali lang. So, Clinton is check. Next, Alfrances is check. Next, Muhammad Jan is also check. Aryan Agoo, check. Fatima Rahima, check. Bustamante, wrong. Wilhelm, check. Bernice, check. Aishar, check. Dennis, check. Yun lang po.
Okay. Next slide. Okay, mating combinations that could possibly produce 25% Rh negative of offspring. A, father is capital C, small letter D, E, over small letter C, D, E, and mother capital R1, capital R1. B, father is capital C, small letter D, small letter E, over small letter C, small letter D, small letter E. Mother is capital R1, small letter R. Father is capital R2, capital R2. Mother is small letter C, capital D, small letter E, over capital C, D, and E. And letter D, father is R2, small letter R. Mother is small letter C, capital B, small letter E, capital C, capital D, and small letter E. Mating combinations of that would possibly produce 25% of Rh negative offspring. Father is capital CDE, CDE. Mother is R1 capital. B, capital C, small letter D, small letter E, small letter D, C, small letter D, small letter E, capital R1, small r. C, capital R2, R2. Mother is small letter C, capital D, small letter E, small letter C, small letter D, small letter E. Or father for letter D is capital R2, small letter R. Mother is small letter C, capital D, small letter E, over capital C, capital D, and E. Timer starts now. Fats.
Okay na, Chang. Wala kasi siya timer, Chang.
Wala siya timer? Okay.
Yes.
Okay. All our answers are in. In na ba, ma'am?
Okay na po, Chang, ina po sila.
Okay. The answer is letter B.
Letter B. So, Alfrancis
Capital.
check. Letter B, no? So, Alfrancis check. Alfrancis is check. Tapos, si next is letter B. Letter B. Hussein is check. And then, yun po. Dalawa lang ang check. Si Hussein at saka
Okay.
si Alfrancis lang.
Okay, we will proceed to number 3. Blood banking. A unit of RBC drawn with additive solutions on August 10, 2018. The label must have its expiration date after irradiations of September 10, 2018. A, 28 days after irradiation. B, September 11, 2018. C, September 19, 2018. D, original expiration date. A unit of RBC drawn with additive solutions on August 10, 2018. The label must have this expiration date after irradiations on September 10, 2018. The blood must be labeled for the expiration. A, 28 days after irradiation. B, September 11, 2018. C, September 19, 2018. Or D, original expiration date. Time's up. And the answer is letter D, original expiration date.
Alfrancis check. Bustamante check. Hussein check. Agoo check. Wait lang ha. Next. Fatima Rahima check. Clinton check. Yun lang.
Okay, we'll next proceed to the next question, number 4. Blood banking. Bromelain is an enzyme used in blood banking procedure from A. Figs, B. Hog stomach, C. Papaya, D. Pineapple stems. Bromelain is an enzyme used in blood banking procedure from A. Figs, B. Hog stomach, C. Papaya, D. Pineapple stem. Timer starts now. Time's up. And the answer is letter D, pineapple stems.
Question number 4. Question number
4.
4 na ito, no? Question number 4. Question number 4. Okay. So, Fatima Rahima is check. Fatima Rahima. And then, Clinton check. Grace Bustamante check. Bernice check. Denise check. Sino ba ito si Birin? Ito na ba si Muhammad Jan? Tama ba ako? Si Muhammad Jan Birin ba ito? Hello?
Yes po.
Okay. Sige, check. And then, Agoo check. Musin check. Okay, wrong. Si Blas Francis wrong. John Wilhelm check. Al Francis Blasa. Okay. Yun lang po.
Okay, let's proceed to the next question. Number 5. C-reactive protein is a modified A. Albumin, B. Alpha globulin, C. Beta globulin, D. Gamma globulin. C-reactive protein is a modified A. Albumin, B. Alpha globulin, C. Beta globulin, or D. Gamma globulin. Timer starts now. Time's up. And the answer is letter C, beta globulin.
Okay, wait lang, sir. Wait lang.
Wala pong nakatama, ma'am.
Okay, C, wala.
Yes, ma'am, all wrong.
All wrong po.
Wrong. Okay, next question from MedTech Law. Who was the pamet president when RA 5527 was signed and enacted into law by President Ferdinand Marcos? Who was the pamet president when RA 5527 was signed and enacted into law by President Ferdinand Marcos? A. Venerable Oca, B. Tito Moraleta, C. Marilyn Atienza. Who was the pamet president when RA 5527 was signed and enacted into law by President Ferdinand Marcos? A. Venerable Oca, B. Nardito Moraleta, C. Marilyn Atienza. Timer starts now. Time's up. And the correct answer is Nardito Moraleta.
Letter
B, Nardito
Okay.
Moraleta.
Okay, so letter B. Lang sa number 5. Number 5 na yun, sir, no? Tama ba ako?
Yes po, ma'am.
Parang tama
Six
po ata
na yan.
lahat, ma'am.
Six na po, ma'am.
Okay,
Six.
i-check ko lang kung lahat nakasagot kasi wait so sign lang natin number 5 no, wait lang.
Number
Sandali
6 na
lang.
po, ma'am.
Number
Six,
6
ma'am.
ay naku
Six,
po.
ma'am. Yes, ma'am.
Sandali lang. Okay, so B, check ko lang isa-isa kung lahat nakasagot. I char, check. Bustamante, check. Agoo, check. Mignon, Dennis, check. Wilhelm, John Wilhelm, check. Brianna, check. Wilhelm, bakit dalawang beses ka, John, nagsagot? Isang beses lang. Okay, next. Clinton, check.
Sorry, ma'am.
Denise, check. Alfrances, check. Bernice, check. Aishar, check. Agoo, check. Fatima Rahima, check. Fatima Rahima. Bustamante, check. Okay, wala na po. Okay na po.
Okay. Okay, next. Blood banking. Oh, Fats.
Wala ni Cham. Kato ang kwan. Blank show.
7. Blood banking.
Kani.
Yes, 7. Okay. In an emergency situation, Rh negative red cells are transfused into an Rh positive person of the genotype capital C, small letter D, small letter E, capital C, small letter D, small letter E. The first antibodies most likely to develop is A, anti-C, B, anti-D, C, anti-small letter E, and D, anti-big E. In an emergency situation, Rh negative red cells are transfused into an Rh positive red person of the genotype capital C, small letter D, small letter E, over capital C, small letter D, small letter E. The first antibody most likely to develop is anti-C, small c, B, anti-small d, C, anti-small e, or D, anti-big E. Timer starts now. Time's up. And the correct answer is A, anti-small c.
Okay, so Alfrancis, check. Clinton, wrong. Denise Mignon, check. Wilhelm, wrong. Bernice, check. Agoo, check. Husin, check. Fatima Rahima, check. Bustamante, check. Okay, wala na po, Dana.
Okay, let's proceed to the next question. Number 8, hematology. The Guglielmo syndrome is associated with which type of acute myelogenous leukemia? A. M0, B. M1, C. M6, or D. M7. The Guglielmo's syndrome is associated with which type of acute myelogenous leukemia? A. M0, B. M1, C. M6, and D. M7. Timer starts now. Okay. And the correct answer is M6. That's letter C. Letter C.
Okay, so Bernice, check. Denise, check. Bustamante, check. Wilhelm, check. Clinton and Isar, check. Agoo, check. Alfrancis, check. Fatima, check. Fatima Rahima. Fatima Rahima, check. Yun, done na po. Done na.
Okay, let's proceed to the next question. Number 9, medical technology laws. Medical technology was introduced to the Philippines by A. 6th Laboratory of the 26th USA Army, B. 26th Laboratory of the 6th US Army, C. 6th Laboratory of the 26th US Navy, D. 26th Laboratory of the US Army. Medical technology was introduced to the Philippines by A. 6th Laboratory of the 26th U.S. Army, B. 26th Laboratory of the 6th U.S. Navy, C. 6th Laboratory of the 26th U.S. Navy, or D. 26th Laboratory of the 6th U.S. Army. Timer starts now. Time's up, and the answer is letter D, 26th Laboratory of the 6th U.S. Army.
Okay, so Alfrancis, check. Alfrancis, check. Next, Aishar, check. Hussein, check. Then, Fatima Rahima, check. Okay, next is Agoo, check. The next is Dennis Mignon, check.
Ma'am, CD ang sa kanya, ma'am.
Ay, sorry. Ano ba ito? Sorry. Wrong to. Sorry. So, wait. Okay, so next. Sorry. Bernice, check. Na isang beses lang tayo mag-answer, Migno. Nag-answer ka na CD, so hindi natin to consider, ha? Kasi may answer ka na kanina dun sa taas ning. Clinton. Okay, wala. So, done na po.
Okay, next question, last question for the round 2 for clinical microscopy. According to WHO guidelines on semen analysis in 2010, The normal morphology of human spermatozoa is A, 4%, B, 14%, C, 40%, or D, 80%. According to the WHO guidelines on semen analysis in 2010, the normal morphology of human spermatozoa is A, 4%, B, 14%, C, 40%, or D, 80%. Timer starts now. Time's up. And the right answer is letter A, 4%.
Okay, wait lang ha. So, question number 10. Wait lang. Okay, nagbabak pa ako. So, question number 10 na po tayo, sir. Is letter A ang
Yes
sagot
po,
po?
ma'am. Yes
Wala
po,
po
ma'am.
nakatama.
Okay. So, wala pong tumama.
All wrong po
Wala
ata.
po. All wrong
Lahat.
po.
Okay.
Lahat. Yes.
Ma'am Danda, can you please recap, ma'am, the
Okay.
numbers or the
Questions,
scores
the
of the...
scores.
Yes, ma'am.
Okay, so Clinton for round 2. Round 2 lang po or lahat na? Round 2 muna.
Round 2 muna, ma'am.
Round 2 is 5. Agoo, round 2 is 8. Brianna, 7. Denise, 6. Aishar, 9. Si Lambo, siguro baka na-disconnect na ito si Lambo, no? Walang signal siguro. Ito si John Wilhelm, 4. Alfrancis, 7. Bustamante, 6. Fatima Rahima Aguilar, 7. Muhammad Jan Birin, 2. And si Mayesha Nan. Siguro baka na-disconnect din to. Hindi din siya nakasagot. Okay, so yun na po. For round 2.
Chang, hinay mong audio. Wala kay audio, Chang.
Ma'am Danda, I
So,
will call you.
highest po.
I will call you first, ma'am. Kindly turn off your unmute. I mean, mute your phone, ma'am. I will call you, ma'am.
Hello? Hello, can you hear me?
Yes, ma'am.
Okay,
Yes,
so at
ma'am.
this point, you actually have tie scores. The next question that Sir Tabunyag will ask will be answered by the following. By the following po. You will just break the tie, okay? By the following. Okay, so Alfrances Lexor. Alfrances Lexor, you please answer the question. And then
Ma'am.
Grace Bustamante, you also answer the question. And Fatima Rahima Aguilar. So yung tatlo po na tinawag ko, sila po yung sasagot sa next question na ibibigay ni Sir Tabunyag. So kung sino yung tama sa kanila, so mag-stop na po tayo. Okay na po ba yun? Sir Richard, okay na po ba yun?
Yes, ma'am. Yes, ma'am.
Okay, so si Alfrances po, si Grace Bustamante po, at saka si Fatima Rahima Aguilar, sila po yung sasagot sa next round.
Okay. Hindi na ipa-flash natin yung ating question ha. I will just read it for you and kindly listen very very careful. And then depende no kung nabe-break natin yung tie. Okay? Kung na-break na yung tie natin, magsa-stop na tayo. Okay? Hello participants, yung tie?
Copy, sir.
Okay, okay.
So,
Kindly
okay,
listen.
inuulit ko po. So, Alfrances Lexor ang sasagot po. Grace Bustamante and si Fatima Rahima Aguilar. Kayo lang po ang sasagot po sa next question po.
Noted ba ninyo? Copy ba? Narinig nyo si Ma'am Arlene? Participant?
Yes, po.
Okay, we will start na ha. We will start. Number 1. Question number 1. Which of the following is the preferable site for bone marrow aspiration and biopsy in an adult? A. Iliac crest. B. Sternum. C. Tibia. Or D. Spinous process of a vertebra. Which of the following is the preferable site for bone marrow aspiration and biopsy in an adult? A. Iliac crest. B. Sternum. C. Tibia. D. Spinous processes of a vertebra. Timer starts now. Time's up. And the answer is letter A, iliac crest.
Okay, so Grace Bustamante, check. So only Miss Grace Bustamante got it right.
Okay, we break the tie. Congratulations,
Okay na.
Miss Bustamante. Ma'am Marlene, kindly announce the winners po.
Okay, so we'll start from the wait, sandali lang Miss Rosh, yung MC, Miss Rosh. Miss Rosh?
Yes, ma'am.
Paki-check yung sa certificates natin. Ano yung champion? First, second place, paano? Champion and then second placer, third placer. Tama ba ako? Paki-check lang.
Yes po, wait po, ma'am.
Paki-check kung ano yung nakasulat doon.
Ate Amna, hello?
Yes?
Si Ate Amna po, ma'am. Kasi nasa kanya po yung search po kasi. Apo.
Okay, so anyway, ganito na lang. Okay, so our third placer, ibig sabihin pang number 3 po siya sa ranking. So our third placer is from ZZMC. We have Miss Grace Bustamante. Third placer is Miss Grace Bustamante. So with a score of 15 points. So this is followed by the second placer. The second placer got a total score of 16 points. 16 points. So the second placer is Mr. Aishar Hussein from UZ, from Universidad de Zamboanga. And our champion for this year's quiz show, virtual quiz show, got a score of 17 points. So got a score of 17 points, and she's no other than Miss Aryen Agoo from Brent BHCI. Tama ba? Brent Betong BHCI. Brent Hospital Colleges Incorporated.
Congratulations.
Congratulations.
Congratulations, Arya. Congratulations.
Okay, so I think the first placer, I mean the champion, would receive or will receive 500 pesos, and then 300 for the second placer, and 200 for the third placer. So thank you and congratulations to all contestants.
Thank you so much to Quizmaster Mr. Richard Tabunyag, Mrs. Arlene Danda, and also to our participants. Congratulations to each one of you. At this moment, the most awaited event of all, the announcement of winners for the different contests, for TikTok competition and digital slogan poster making competition. May we call on Miss Fatiha Amanon Alamuddin for the announcement of winners.
Hello, good evening, everyone.
Good evening po.
Ma'am Arlene, I'm just waiting for Sir Richard.
Okay, ma'am. Okay po.
Thank you, ma'am. For the meantime, ma'am, can we play again the TikTok entries? Thank you po.
Miss Amna, can you hear me? Miss Amna? Miss Amna? Miss Amna? Huh? Miss Amna, can you hear me? Can you please play again the TikTok? Amna? Wait. Rosh, pakitawag kay Amna. Pwede ba?
Yes po,
Pa-play
ma'am.
ang TikTok ulit. Yes. Thank you.